Hello and welcome. My name is Nercy Sullivan and I'm here with Dr. Sbayi. Welcome.
Thank you.
To tell my story. 2 years ago, I met Dr. Sbayi when I was researching to get hernia removal surgery. In my search, I saw 5 doctors. Everyone wanted to put a mesh in my body. I'm a PKD patient, and my biggest fear is I know I'm going to need a kidney transplant at some point, and I didn't want to have any objects in my body that will obstruct the future surgeries. So finding Dr. Sbayi at the point when I was really concerned was crucial. And here he is to explain to us what are the great benefits of getting a hernia removal surgery without a mesh. Dr. Sbayi, please welcome.
Thank you, Nercy, for having me. This is such an important topic to help guide patients that they know they have options. So that is the most important thing that they should know. And you don't have to settle for one physician. Go around, ask for a second opinion, and it's totally fine to do that. You have to have the courage to do that. So hernias, usually you can have 2 options, mesh or no mesh. The current guidelines recommend mesh, but there's an experience out there which is very unique that you don't find at every facility, and it's not available with each surgeon because the training is not there. We mostly focus on mesh. So the no mesh experience is mostly from the Shouldice Hospital in Toronto, Canada. And they've been doing it for over 80 years. And so there's a handful of surgeons who've been operating there who have this experience, and they do hundreds of surgeries every year, and they've developed this experience to the point where the recurrence rates on properly selected patients and the chronic pain rates on properly selected patients are very low, and in fact are very equal to mesh. But it foregoes some of the complications with mesh. So mesh can have some complications. And in certain special cases of patients like Nercy, and it doesn't serve them very well to have an implantable object in them because they will be immunosuppressed. Their immune system is not at its best. And so when you challenge it with something which is a foreign object, you don't want your system to start fighting that. And so if there's other opportunities, you can do that. So mesh-free is definitely a good option. In my practice, you should be a BMI of 30 or less, and that BMI, you can Google it. It's a calculation of weight over height, and it gives you a number, and the number should be 30 or less. That ensures that you will have low recurrence and low chronic pain rate.
One of the issues that I had when I made a decision to get the surgery was I have 3 hernias. And Dr. Sbayi was very concerned about doing it because of the pain, but I insisted that I did wanted all of them removed on the same day. And I'm so glad I did, but it might not be for everyone, right,
Agreed.
Dr. Sbayi?
Oh, absolutely. We all get nervous when we do multiple procedures on patients because we're concerned about your recovery. We want you to have a very good experience and not a miserable experience. So more than one surgery is usually not recommended. But in those cases, most patients really don't want to come back again. They want to have one anesthesia, and they want to have it all done in one shot. And so, but there's ways to do it, and Nercy taught me. Maybe next time the recommendation should be admit the patient, manage the pain, and so they can have a better experience. But it's doable. Most patients really have a very active lifestyle like yourself, and they're very busy. They can't afford really, from a time perspective, to actually come back again and have it done.
Yes, that was my experience. I had the 3 hernias removed in one day. The first week was rough, but after that, I'm so glad I did it. And now that I'm preparing for a kidney transplant, I don't have the fear that that mesh can interfere with the next surgery.
Yes, of course. I mean, that's important, and that's any implantables. It's not just the mesh. It could be breast implants as well. You have to take that into consideration. If you're immunosuppressed and you are a recipient of some sort of transplant, you will be put on medication that will suppress your immunity, and so you don't have the best immunity actually to fight off a regular cold or infection or even a mesh implantation.
Question, if someone had already a surgery with a mesh and they are having discomfort, what is the option?
So we have to make sure that it's certainly from the mesh. And so a physical exam is very important. And then the physician needs to listen to the symptoms that the patient is having. If this turns out to be something that really impacts their quality of life in a very meaningful ways, which means I can't come to work anymore, or I can't spend all the hours at work that I was spending before, or the simple things, I can't spend time with my children or go out and enjoy a dinner with my family without having this discomfort. That has to be considered very seriously, and there are ways to work this up. We have to rule out other things other than the mesh as well. So imaging is available, so we have ultrasound and CAT scans and MRIs. Physical exam is very important as well, and then considering the story as well, and then making a determination, should the mesh be removed? And there are certain circumstances where the patient will benefit from mesh removal, where the mesh has become infected, we can't pick it up, or there's an allergic reaction, a sensitivity, we can't pick it up, or the mesh has moved, and the mesh can move and cause other issues as well and erode into surrounding structures. So it's important to consider all these things and have that discussion. We should probably focus on the special cases, and the special cases are individuals who may be immunosuppressed, those who will get transplants. You should know that when you're immunosuppressed, you have less of a protection against infections, simple cough and colds. But if you have an implantation, we as physicians are concerned with your ability to accept the implantation. So whether it's mesh or breast implants, that is a big concern. Many transplant patients tend to go to hernia surgeons who do no mesh, or they have mesh alternatives. And we have many mesh alternatives these days, and they could be absorbable or partially absorbable, and they're less frequently permanent material. The material in it is polypropylene, it's plastic, and we're exposed to that every day. But certainly there's a patient population who are highly sensitive to that. So you should talk about, mesh and no mesh options. Feel free to go from one surgeon to another until you're comfortable with them, and then ask about the mesh alternatives. All right, you should be well versed on that based on the conversations with your surgeon. Then there are patients who have allergies and sensitivities to any implantables, and that could be sutures. I've had patients who walk into hotels and they break out in hives. So they're terrified of being exposed to a foreign material that may set off a severe allergic reaction. And severe allergic reactions may be anaphylactic shock, where people need to be intubated and we help with their breathing. So you need to take the time to consider what the options are. And thirdly, age is really not a hindrance to mesh repair, right? You can have mesh repair for any age, and no mesh is an option as well. But most important, you need to know you have options. Ask about no mesh if that's what you want. And it may be your personal decision. You don't want to have anything implanted in you. That's a fair decision, it's your body. Keep on searching until you find that physician that can do it for you. I have athletes who come who want to have complete flexibility and range of motion of their limbs, because they're very competitive, and that may be their livelihood. And so we're concerned sometimes that the reaction they may have to mesh may constrict and limit their ability to do that. So things to consider, things to talk about when you see your surgeon.
Wonderful. This is a great information for anyone who's interested or has any hernia. There are options, and Dr. Sbayi is available. And please tell us again where you are, where we can find you.
In Glen Cove, New York, 11542. It's at a hospital called Glen Cove Hospital. It's part of the Northwell system here. We're probably the largest privately owned healthcare facility in New York.
Wonderful. Thank you so much, Dr. Sbayi. This is a wonderful information that can help a lot of people make choices that now we know we have more options. Thanks again for joining us.
Thank you so much.
My pleasure.